A very good morning to all. In today's session, we are all going to learn what is all about health and nutrition indicators. So let's begin with the introduction. So automatically we can see that health is a valuable asset and it's a common quote that the health is wealth. So as per the human development perspective, good health and nutrition are the invaluable assets that ultimately leads to an individual physical and the mental development, and it also contributes to the development or the growth of an individual and to live a healthy life. Malnutrition is always a major concern in India. It always increase the susceptibility, infection, and always delay to recovery and always make a burden of a disease on a human being and ultimately a major issue for a country. In most of the developing and the underdeveloped countries, unfortunately, malnutrition is a chronic problem for you can see all those individuals who are actually suffering the same in India, and it always you can say in respect of the health, nutritional diets automatically the lower percentage exists in India. Especially when it comes to the in case of children, the situation even more vulnerable as according to the World Bank of India. As per the World Bank, 22% disease burden to the Indian children is just because of the malnutrition. So malnutrition is actually a major concern in India, which ultimately increases day to day in India. Moreover, conceptually, we can talk about the health is all about the freedom from the illness. It is measured in terms of the illness prevalence rates and the functional disability measures, or you can say the remediable remedies. A person would call a healthy life or when he or she having a low illness prevalence rate, and of course there's no chance to have a functional disability. When we talk about the as the health and the nutrition are interrelated to each other, so automatically the nutrition is a measure of nourishment. It is a process through which the body absorbs a nutritional diet as contains in the food that a particular individual consumes. And of course, due to such health nutritious diet or the healthy diet, the health status is always of an individual could be on you can say maybe you can say live a healthy life. Let's talk about the measurement of health. When it comes to the current level of the Indian development, the health scenario in India is also improving. Not in terms of infant mortality rate, but under the five mortality rates, India has achieved a significant growth and improvement over the last few years. Over the last roughly 2 decade periods from 1992 to 1993 and 2015 to 16, automatically the infant mortality rate has come down from 86% to 41, and it's a huge decrease percentage till yet. And of course, the under 5 mortality rate from 119 to 50. And it is very important to understand the major indicators which where the measurement of health could be possible, and of course it could be calculated according to the number of years or the respective years. So let's begin the major indicators where the calculations of the health could be estimated. The first one is infant mortality. What is infant mortality? Is a probability where a newborn child death before its first birthday. When a child is born and he or she died before its first born birthday, that's actually called the infant mortality. And it is numerically being calculated according to the number of infant birth per thousand live births in a year. And it could be calculated as per the number of the resident infant deaths by number of resident live birth into 1000, as it is being calculated in the number of the infant death per thousand live birth in a year. So automatically, when there is a number of resident infant death and the number of birth, and then automatically into 1000, that you will get the infant mortality rate. We can take up an example, let's say in 2016, among the state residents, we are talking about the state wise, the number of infant death is 1300 and the number of live birth in the state is 1,50,000. As per the World Health Organization report, 75% of the world under 5 deaths is within the first year of infant life. That means that more than the, you can say, the 70% or the 70 or below the 70% of the child died before its first birthday. It's a huge percentage where the child is automatically, you can see, came to a death before its first birthday. So that is the exact statistics of the WHO. The next one is neonatal mortality. This is also a probability where where a particular child dying in the first month of its birth or within the first 28 days of a life at the infant after birth. When a child takes birth or when he died within the first day of its birth or after, you can say, or within 28 days, the child has died after birth, and that is called the neonatal mortality. So neonatal mortality can be estimated numerically as the number of neonatal deaths by total number of live births in 2000, as if it's an infant death per thousand live birth is a numerically being calculated, and that's why it is being multiplied into 1000 live births in a year. As per the UNICEF data, the worldwide neonatal mortality rate has actually decreased from 36 deaths per thousand live birth in 1990 to 19 deaths per thousand live birth in 2015. In a year, it's around 1000 birth of a child takes place, and out of that 36 deaths exist in 1990 and 19 deaths exist in 2050, which is ultimately a decreased level in a neonatal mortality rate. Next one is under 5 mortality, where it is also called a child mortality rate. It is a probability of dying between the first and the fifth birthday. So if any child died between the first and fifth birthday, that's actually called under 5 mortality. That means a 5 birthdays. So any child who's died between the first to fifth birthday, that actually called under 5 mortality. And actually it is measured in the same categories which I have taught. It's number of death per thousand per year. So numerically it will be calculated as a child mortality rate, which called CMR, is equal to death per year by, you can say, the number of birth into thousand, where the D is a death, and the which between 0 to 4 years, as between the first and fifth birthday, the age is occurs between 0 to 5, and N is a number of live births among the newborn during the year of calculation. So when we talk about during for the purpose of mathematical calculation, the data is always being registered in the of a newborns. So according to the World Health Organization, it's nearly in the world 9 million childs died before their fifth birthday, and the major concern or the causes of the factors of their death is its phenomena, diarrhea, and the malnutrition. So these are the factors the where the child actually died between the first and fifth birthday under the 5 mortality rate. And it always be measured by the number of deaths per thousand per year. So the next category of the health indicators to measure, that is the post neonatal mortality. It is a difference, it refers to a difference between the infant and the neonatal mortality rate. That means the number of newborns dying between 28 days and 364 days. That means whatever the newborns child's dying between the 28 to 364 days, that actually called the post neonatal mortality in a particular geographical area. And of course, it is divided by the number of residents live birth in the same area. So automatically that means it automatically shows and reveals that it would be divided by the number of resident live birth in a same area. So automatically it would be multiplied by the 1,000 per year to indicate the mortality rate per 1,000 live births. So when it comes to the mathematically to calculate the post-neonatal mortality, it's a number of resident post-neonatal deaths by the total number of resident live births into 100. So automatically, when we talk about the four categories of the health indicators to measure or to calculate, so every time would multiply by the number of deaths per thousand per year. That means whatever the deaths, number total deaths and the total live birth in a year into 100. That's that is actually the rule of to calculate the mortality rates under these particular categories. The next one is maternal mortality rate. It refers to a number of women who died as a result of childbirth and the pregnancy related complication per 1 lakh live births. So automatically, when we calculate the maternal mortality rate, so whatever the maternal deaths of a child by a total number of live birth into 1 lakh. So that is called the maternal mortality rate. So it refers to a total number of women who die as a result of a childbirth or the pregnancy related complication per 1 lakh live birth, and that is called the maternal mortality rate. When we come up to the calculation or a mathematical calculation which states MMR, it's equal to the maternal death during a reference period. It would be 3 months, it would be 6 months, it would be 8 months. The child is dying is by a total divided by a total number of live births during the reference period into 1 lakh. And once you get the values and you put into the formula, you will easily calculate the maternal mortality rate. According to the UNICEF data between 1990 to 2015, and almost the maternal mortality rate has almost decreased by half or 50%. That means half of the, you can say, the population globally has been reduced in case of maternal mortality rate. So this is the health status indicators of 1993 to 2016. So when it comes to the status in India, the birth rate, death rate according to the region-wise, rural and urban. So a natural growth rate, infant mortality rate, sex ratio, population in 0 to 6 age group, child sex ratio, literacy rate. So when it comes to the region wise, that is classified into two categories, that is the rural region and urban region. So when it comes to the birth rate, automatically the rural the birth rate is more than the urban region to rural region, and automatically when it comes to the death rate, 7.8%, it's more than the urban region. When we talk about the natural growth rate, automatically the more percentage of rural region is than the urban region. Infant mortality rate, that the urban region infant mortality rate, that is 34, is actually less than the rural region. When it comes to the sex ratio, automatically the more percentage or the more in number is in rural region than the urban region. Population in 0 to 6 age group, the more percentage is also exists in rural region than the urban region, which relates or by a difference of 4.82. When we talk about the child sex ratio, the more percentage in rural than urban. As per literacy rate, when it comes to the literate rate, automatically, or the literacy level, that automatically the more percentage is in urban than the rural region. So when it comes to the health status, then automatically the rural region is almost more than the urban region. The more and more percentage is in rural region, whether it's related to the birth rate, whether it's related to the death rate, whether it's related to the natural growth rate, mortality rate, sex ratio, population, child sex ratio, literacy rate as well. So when we talk about the health status indicators, which has been classified into rural and urban areas as per the status or the data from 2011 onwards. Now we talk about the malnutrition concept. Malnutrition may be an overnutrition or the undernutrition. So when we classify into main two categories, that is over and undernutrition. Undernutrition is measured due to the various factors like underweight, stunting, and wasting. Wasting is automatically a situation where an individual does not receive the adequate nutrition in the period whenever required immediately as per the survey studies conducted in India. And of course, it is a sign of a malnourishment. It may be due to the inadequate food intake in whatever the period, and ultimately leads to illness, which cause a loss of weight and of course the onset of malnutrition. The persons who belong to the ratio Z score, that means it's a ratio of height and weight, is actually below -3, that is called the standard deviation. This is a Z score where the particular ratio of weight to height would be measured. And of course, if any person belongs to -3, a standard deviation of the out of the population or among the population, that means he belongs to the malnutrition case. And of course, when we talk about the severe malnutrition, then ultimately it's belong to the -2 ST, which called malnutrition. So automatically there is also statistical tools to measure whether an individual is belong to the malnutrition or the severe, you can say malnutrition. So automatically there is a score when we talk about the person who belong to the malnutrition, that is -3 ST and the -2 ST. Now we talk about the current status of the malnutrition. The first one is undernourishment. When we talk about the undernourishment, around 14.37% of the Indian population is estimated to be the undernutrition according to the world meter, that is called 2030. And of course, when we talk about this 14.37, so roughly we can take up the 161 million people. When we talk about the starting, when we in this particular case, the 35.5% of children under 5 year of age and are actually started. So as per the, and this data has been considered according to the National Family Health Survey, that is called the NFHS 2019 to 21. When we talk about the third status of wasting, which is a part of the malnutrition, that is the 19.3% of children under 5 years of age are actually wasted. And such data has also been collected from the National Family Health Survey, that is 2019 to 21, that is of 5 years. Next concern or the next current status of the underweight, that is 32.1% of children under the 5 years of age are underweight. Anemia, that is 25% of men, that is between the age group of 15 to 49, and 57% of women, that is under the age group of 15 to 49 years, and 31.1% who belongs to adolescent boys under the age group of 15 to 19 years are actually suffered from anemia, and such data is also being collected by the National Family Health Survey. When we talk about the next current status of the Global Hunger Index, that is called the GHI 2023, India ranks among the globally, that is 107 rank out of 121 countries with the score of categorized a serious hunger. So India has a highest child wasting rate according to the global hunger index, that is 18.7%. That means India is actually suffering a serious concern of malnutrition, where actually the half of the population, especially the children's, who are actually suffering from malnutrition and dying with the malnutrition only. So that is the concern where the current status, where the huge percentage it comes undernutrition meant stunning, wasting, underweight, anemia, and according to the global hunger index, these five factors is automatically portraying the serious concern of the malnutrition status in India. Now we come up to the malnutrition data in India. So according as per the you can say uh, last 10 years data, that is the first national family health survey of 1992 to 1993. India was one of the worst performing countries on indicators of our child health. Of course, as in present also, the major concern is a malnutrition status where the number of childs died in a year more than a half per 50%. According to the Food and Agricultural Organization report, 194.4 million in India are undernourished. Why? Because they are not taking up of you can say adequate intake of food, and as a result such a huge percentage of people in India are suffering from malnutrition. In the Global Hunger Index 2019 ranking, as India is ranked 102 out of 117 countries. So that is also one of the you can say major data uh, where India is ranking 102. That means it's a huge percentage where the number total where the number huge numbers are suffering from malnutrition. According to the government figures for 2015 to 16, 22.9% women in the age of 15 to 29 our group were underweight when it compares to the others group data under the same age, whether males or females, that is 20.2% of men. That means the women are actually suffered from more malnutrition as compared to the men. Then ultimately it leads to both are actually suffering, males and females, from malnutrition situation. As per the data of the State of Food Security and Nutrition in the World 2020, and in 2016, about 51.4% of women of reproductive age in India are suffering from anemia. So automatically, it is also the one of the cause or due to the malnutrition only. About 60 million children. We can talk about the roughly, that means 50% of the population of children in India are underweight. 45% are studied, 21% are wasted, 57% are vitamin A deficient, and 75% are anemia. So automatically, when we look up about these percentage and among and consider the data of among 60 million children, then ultimately these percentage are actually large in numbers, and India should always take up an immediate steps to reduce the status of malnutrition, to elevate the malnutrition status in India. So as per the data released by UNICEF, India is almost on 10th spot and 17th spot among the countries when we compare with the countries who are having the highest number of the underweight and the studied children, especially when it comes to the states of India and who are actually suffering the underweight of childbirth in India, that are Rajasthan, Madhya Pradesh, Uttar Pradesh have the highest number of the underweight childbirths in India. As per the Indian Council report of medical research in 2017, malnutrition was a predominant contributor to the under 5 mortality rate in every state of India. That means the child dying between the first to fifth birthday as per the 1000 live births in a year, then automatically malnutrition is a major contributor to such deaths in every state of India in case of children's. As per the statistics, under the undernutrition in India actually seems to be a gendered problem. So automatically, whatever the norms related to the social or the cultural population distribution is always suggests that the distribution of resources should be done in a hierarchical manner. That means with male members of the family at the top. So whatever the you can see male member who can term as a head of the family, they could considered as a top as compared to the rest of the members of the family. Malnutrition as well as the prevalence of stunting, wasting, and nutritional deficiencies among children and women or males are well recognized elements of India nutrition profile in the global hunger index. So automatically when the any report will be generated by the global hunger index, then automatically India is in top spot where the prevalence rates of stunting, wasting, nutritional deficiencies of children will always comes on top as per the global index, the global hunger index reports. According to the National Family Health Survey 4, the percentage of wasted, stunted, and the malnourished children in 2015 to 16 was 21, 38.4, 35.7 respectively. So when there is a comparison of the National Family Health Survey reports of 2015 to 2017, then automatically it shows a slowed improvement of 5.4%, 3.7%, or 2.3% in the respective categories of the malnutrition, that is wasted, stunted, and the malnourished children's. When we talk about the presence of the malnutrition in India has automatically declined over a decade, but the report of CNS survey that is of 2017 to 18 report revealed but the major challenges it still remain in India as the situation is not even you can see elevated permanently in India. Still the 50% of the population are actually suffered from the malnutrition as with the severe malnourished children or the moderate malnourished children. Now we can talk about the health expenditure. When we talk about over the past centuries worldwide, whatever the expenditure on healthcare has always been increased consistently over the years. The shares of the gross domestic product are actually devoted in medical equipments, medical surgeries in the OECD countries, where the health expenditure has been increased from 5.1% in 1979 to 8.9% in 2016. This particular figures are always increased on a public healthcare expenditure in India, and of course, it's increased marginally from in the respective years, that is 1915 to 2014, that is on a marginal basis from 1.1% of GDP to 1.4% of GDP. That means by a difference of 0.4% of GDP. So such percentage of GDP is actually leads to a public health expenditure, then automatically focus on the healthcare facilities, but still the public financing challenges is almost exist for all the countries. What are the factors that influence the health expenditure? When we talk about the factors, they are reclassified into two main categories. The first one is demand factors, and the second one is the supply factors. So here we are talking about now the two main categories of factors that actually influence the health expenditure. The first one is demand factor, and the demand factors are categorized into three main parts: the population aging, income, and the spread of insurance market. So when we talk about the population aging, then of course, whatever the average age of the population is being increased, the demand for medical care is also increasing. Income, and automatically this is a well acceptable fact that there is a strong relationship between the per capita growth and of course health spending. So whatever the you can say the income, the demand of healthcare would get increased according to their income for the healthcare spending, it depending upon the various factors. It could be a geographical reasons, yeah, time, your schedule, etc. Next one is spread of insurance market. So whatever the growth of health insurance market, whether it could be increased or decreased, but automatically depends upon the demand for such healthcare expenditure, and insurance is also the important you can say instrument, a part of a particular human beings or the population who actually covered the risk of rising or the increasing healthcare cost in India. Next is supply factors. So when we talk about the supply factors, that is the supplier induced demand. Sometimes we can talk about there are so plenty of the health service suppliers who actually create for the demand for the healthcare facilities so that their market share could get increased, and that is actually called the supplier induced demand. So when any health service suppliers just generate the demand for the healthcare facilities to get a larger market share, that's called the supplier induced demand. And this could be done by the adoption of a new medical technology providing medicines and the treatments. It's not exactly related to the patient condition, but also try to adopt a new versions of the medical technology, how they can serve to the patient more, you can say, more calm and more relaxfully. The next one is journal economic growth. When we talk about the economic growth of the country, of course, it totally depends upon the living standard of the population, and it totally depends upon the availability of the improved medical technologies only. So when there is a need of improved medical technology or the advanced medical technology, then ultimately it induces for you can say healthcare expenditure. That means it ultimately induces you can say a demand for such healthcare expenditure when but even any or the government or any public you can say hospitals would be uh, needed on improved medical technologies. The next one is sources of health expenditure. When we talk about the sources of health expenditure, there are two main channels for expenditure on healthcare. That is the state through the public expenditure. We can talk about the public health expenditure. And the second one is the individuals, families through their personal expenditure, or they can cover up the hospital expenses or the hospitalization expenses. So the first one is the state, that is the public health expenditure, where the state you can say fulfill the demands for the medical care facilities for the particular population according to their geographical locations or time frame, within the time frame. And the second categories of the sources of health expenditure is the family and individuals through their personal expenditure, or we can, in other words, we can call the out of pocket expenditure. Public expenditure is consists of all government expenditure on health and family welfare. It also includes the major expenses on medical education, research, hospitals, public health care centers, and the different types of the subsidies which where the government would be given. There is always a need of a huge network of primary health centers, and it totally depends upon the health and breadth of the country. And of course, there is also a strong need of the government schemes like GSS, medical reimbursement schemes, and of course, in India there are plenty of the health schemes which has been provided by the government to all up to the Indian population, whether they belong to the rural states, whether they belong to the urban states as well, or regions. Health expenditure, of course, is increasing to India due to the following factors. The first one is increased life expectancy, the demographic change with the share of aged population, and the third one is increase in chronic diseases. So, when we talk about the per capita public health expenditure in India, which almost increased the 5 times over the period of 1995 to 2004, and of course it's almost increased from 1.1 to 1.4% in in that particular respective years. Out of pocket expenditure is also being increased, where the cost share, where the particular hospitalization cost will be shared by the patients or their families themselves, which is quite very high. So, according to the World Health Organization, the total out of pocket expenditure on healthcare has also been increased from 76% to 90% from 2015 to 2012, and automatically it's such increase of out of pocket expenditure is witnessed in many countries over this particular period, that is 1990 that is 2005 to 2012. Such huge you can say 7 years, or the out of pocket expenditure is almost increased in a huge in numbers, and it cost it witnessed in many countries over this particular period. Now we can talk about the public healthcare system in India. So when we talk about healthcare spending in India, it's divided into two types of spending. That is the public and the private spending. So when we talk about, there are plenty of the policies where the government has been implemented in India, and it depends upon the various factors, and of course challenges is also exist for the health sector in India. For example, we can take up nearly 75% of the health infrastructure, medical manpower, and other health resources are concentrated in urban areas as compared to the rural areas where the 27% of the population resides. To reduce such differences, public health is major to focus on health promotion and take up steps for the disease prevention and to control the social determinants or the factors of the health. For example, the environment, the social environment, the friendly environment, the medical equipments where the every person or the particular locations where the every person should get a proper treatment in the government hospitals. So the focus of the public health should also be bringing about the changes not only for to prevent the diseases but also to promote or the health through an organized chain between the medical healthcare centers, the medical professionals, the medical help desk, etc. So this is how the situation of the public healthcare sector could improve by taking up the or by understanding the challenges of healthcare sector in India. India, of course, is the second most populous country in the world where all the social, political, demographic, and mobility pattern changes according to their time. Most of the states of India is, of course, facing the shortage of the healthy workforce. And of course, the large number of health service providers, the managers, and the support workers are always trying to fill such gap when to fill such shortage in the many states of India. In fact, the many states of India are also unable to provide the basic, the minimum, the life-saving services in a precise manner to the Indian populations according to the geographical reasons. In fact, there are many challenges where the public healthcare system in India is actually not moderate even. So the reason behind can be summarized as under inadequate resource availability of public healthcare. There is no proper resources. This is a challenge for the public healthcare sector. Several geographical and the social disparity, inadequate integration between the health programs. There is also a lack of the community where the particular members would come forward to support or to improve or to take up a steps to improve the public healthcare systems and just uh, have you can say interaction with the government, state governments. Next one is fragmented functional responsibility. Of course, there is a lack of functional responsibilities where the particular, you can say, the hospital administration would not come forward to become a responsible for to work properly for the patients. Inadequate attention to primary health care, inadequate public health orientations. Whenever the you can say the employees or the workforce would come forward actually to conduct the workshops or the seminars or that how to prevent from the diseases, especially they actually are inadequate to focus even those areas we cannot able to reach. So that is also the one of the major challenge of the public healthcare system. Now we can talk about the next is preventive and curative healthcare. When we talk about the preventive healthcare, they are talking about all taking up all those measures to prevent from disease and as well as to have a treatment on such disease. And we will talk about the varieties of the interventions which need to be undertaken to prevent or to avoid or to make the delay of the occurrence of the disease or reduce the transmission or exposure to disease. And the several measures has also been considered like alcohol misuse counseling, blood pressure screening, cholesterol screening, depression screening, diabetes and the diet counseling, hepatitis B and C screening, Sprehel screening. For example, when why this? Because whenever there is any disease occurred in India, so it is very, it is necessary and mandatory to take up preventive and curative actions or the measures. Let's take an example. In a college, there are plenty of students studying, and when there is a case of there is a one case of COVID, and automatically the the hospitals workforce would come into the various universities and give a directions that how to prevent the disease from the COVID. So same here also. So whenever any disease has a chances to occur, it is very necessary to take up preventive measures in advance to how to you can say reduce the transmission of such disease through such particular uh, measures like hepatitis B and C screening, Sprehel screening, and anemia skin screening, campaign on importance of the breastfeeding, folic acid supplements, UTI screening, autism screening between 18 to 24 months, immunization, vaccination, iron supplements, and the vegan screening. So it is very important to understand that any disease which comes to anywhere in the world, the hospitals would always be alert to take up measures for Indian population. Curative healthcare always refers to hospitalization who help the patient treated for a disease. There are so many, you can say 22,000 dispensaries and 28 hospitals as well in India. And in present, the numbers has also been increased more. In spite of this, there is of course that in India the healthcare system is always facing a challenges, of course, in terms of medical facilities, supply and staff is also you can say in shortage. So budget is also the one of the major concern where the different state-run units in terms of healthcare is also a problem. Underfunding is also one of the major concern in India. Private hospitals, of course, are provided a concessional land where the liberal tax structure, along with their conditions, is also being eligible. And if any private hospitals obey that, they definitely provide such services, but at a higher or expensive rate. So automatically, when there is a land where a liberal land structure, so automatically there is no proper monitoring where where whether the private hospitals actually fulfilling those obligations or not. And of course there is no proper quality control. There are in terms of where a small hospitals, where a small nursing homes which are run by the private doctors and doctors agencies. That is something a major concern in India where such you can say, activities is to be done. The next one is health financing. The major demand requirement for the finance is the particular person or an individual is ability to pay. A financing structure we can call progressive if any healthcare expenditure takes a larger proportion of income from the rich rather than from the poor. So when larger and larger income would comes in case of healthcare system, then automatically the situation of India could be a dream to provide a good healthcare services to population. So, of course, we can talk about here the expenditure is healthcare expenditure is actually is on high is on the peak level where it would be very difficult for the poor to bear such expenses in India. There are plenty of studies where the user, even a single user, charges for any particular medicines or the counseling, which also a huge expense for the poorer households in developing countries. And that's the main reason that there should be a strong, you can say, measures to be taken while considering the fact of that health financing structure of India is actually weakened. Health financing is divided into two parts, public financing or private or individual financing. But still, the health financing of India faces a major challenges by the government. How much to invest, where to invest, how to make up a balance the health investment due to the such factors like equity and efficiencies, one of the main few concerns for that for to making up the balance between the investment on health and of course the ability to pay. Then increasing public healthcare expenditure is one of the major concern when it comes to the pulse polio immunization for a delivery of the services where the finance is to become more efficient and effective use. It would be a one of the reason where the shortage of resources are always available and how they will provide the more effective services to the population. It always definitely the financing, the health financing always provide the financial protection, but due to a cost of rising healthcare, it could be a major concern for the poor. So that is a major issue in India that it's okay where the richer people would always invest a huge income, you can say for their treatments. But what about the poorer household, the poorer people, how they will get a chance to get treated for their own diseases that actually they face at uh, you can say present. So that is also the major challenges which always faced by the government with regard to the healthcare financing. The current distribution of such major health insurance premium, it would depend upon the households, the government, and other employees, which actually a major percentages like 45.5% of household, 27% of government, and the employers of 23.5%. So automatically, there is a strong need to have a health insurance coverage for even most for inpatient and outpatient for those particular patients who are actually admitted in the hospital. A comprehensive health insurance is also being you can say such services is also being offered in a selected health selected social health insurance scheme of the government like employee stock insurance, community government health insurance we call CGSS, which is a which covers actually a small section of the population in India. And that is a major concern, that how the people gets treated due to the rising cost of healthcare expenditure. Even a few private insurance companies are also providing pre and post hospitalization follow-ups with a few major sections of the society, and such sections of the society can able to avail. So the goal, and there is also another government health insurance scheme whose name is Universal Health Insurance Coverage, which always faces a major challenges, that how to reach to the rural regions, or to cover up all those people who are actually residing in the rural regions. And it's a major challenges of for it's for Indian policymakers as well as government. So automatically, when it comes to the overall insurance companies, which always in need to provide pre and post hospitalization follow-up services, and the goal of such insurance schemes is to get them insured so that the treatment is to be provided in the public hospital very well. That's it for today. Thank you so much for listening, and namaste to all.